Today I'm going to give you a presentation on generalized anxiety disorder. I chose this disorder because of the prevalence in society. I'm going to give you an overview of the anxiety disorders, and then I'm going to specifically discuss the generalized anxiety disorder, otherwise known as GAD. It's going to include the clinical definition from the DSM-5, an assessment, diagnosis, and treatment. We're going to briefly examine legal and ethical issues, cultural considerations, and barriers associated with treatment. Now, the DSM-5 defines anxiety as something that causes fear, worry, and disturbances in behavior. Individuals can present with more than one type of anxiety disorder, and they often coexist together. But clinicians can differentiate between them from the types of stimuli that create worry and fear and avoidance. Fear changes the autonomic system, where anxiety creates muscle tightness, hypervigilance, and avoidance behaviors. So, for the definition of generalized anxiety disorder, we can say that it is a disorder that causes excessive worry and fear about events or situations that have not occurred yet. It has to last for at least 6 months and be present more days than not. And the individual worries about multiple things. And the worry is so intrusive that they find it difficult to control their own thoughts. Okay? In order to be actually diagnosed with the disorder, an individual has to have, for an adult, at least 3 of the following symptoms, and children only have to have 1. And those symptoms are feeling uneasy about normal life situations such as work, health, relationships, or children. Anxiety is evasive and enveloping that person's life, and that it occurs without any type of stimulus being present. It's frequently accompanied by feelings of edginess, impatience, or agitation, fatigue, difficulty concentrating, and problems with sleep. It prevents individuals from completing tasks in an efficient manner and is not better explained by substance abuse, medical disorder, or other types of issues. It is more prevalent with people of European descent, and it is 2 times more likely to develop in women. It is also the focus of the worry is developmentally appropriate, because children usually worry about school and performance issue, where adults worry about family and their health. The risk factors of developing this disorder has to do with people who are self-conscious or who are more neurotic, social isolation, and who have experienced adverse experiences. And also there's a genetic component. It is comorbid with other disorders such as depression and other anxiety disorders. A differential diagnosis for an anxiety for GAD is important to look at what's causing the fear and the resulting cognitive ideation to see if there's another type of anxiety disorder that's also existing. Other types of differential diagnosis could be PTSD, obsessive compulsive disorder, depression, psychotic disorders, or substance medication-induced anxiety. To assess for this disorder, the clinician can, at the psychosocial intake, do the system checklist 90R, which is found in the DSM-5, and they have 2 levels that it goes to. So if they score a certain amount in the first level, then they would do the second one. And also refer the client out to get a medical evaluation to rule out any underlying conditions. The best treatment, according to from our reading, Ray, is CBT therapy or mindfulness therapy. CBT helps to change the thoughts and the irrational beliefs, and it puts emphasis on thinking and not feeling, which is really well received in many cultures who have difficulty expressing their emotions. And so they learn how to reduce their anxiety themselves. Mindfulness helps people to keep a present focus, and it kind of helps them to release the anxiety of worrying about the future. Barriers to treatment would be the stigma associated with mental health, insurance, the ability to self-pay. Some people, can't afford to self-pay, or they don't have insurance. In conclusion, The definition of GAD is an excessive, unrealistic worry where it's difficult to control. You experience motor tension issues, hyperactivity, hypervigilance, and avoidance. The best types of therapy for it is CBT or mindfulness, where the client can learn coping skills and relaxation skills to change their behavior. Depending on the severity of the anxiety, they may need to be referred out for a medication assessment. Knowing symptoms is what's important about this presentation is that if you know the symptoms of the disorder, that you can get yourself or someone else help so they can start living a more focused and intentional life.